안녕하세요. 매일매일 운동하기 실천하고 있는 동타 왕코입니다. 오늘 원래 영어학원을 가려고 했는데 영어학원 선생님이 바빠요. 그래서 다음 주 월요일부터 영어학원을 가기로 했습니다. 그래서 이번 주는 운동을 열심히 하려고 해요. 마지막 운동입니다. 마지막 운동. 이제 영어학원까지 가면은 체력이 못 버팁니다. 운동할 수 있는 체력이 안 남아있을 것 같아요. 일단은 스트레칭이랑 팔굽혀펴기를 하도록 하겠습니다.
know from my discussions with foreign leaders thus far that they are hopeful that the United States democratic institutions are viewed once again as being strong and enduring. But I think at the end of the day, it's all going to come to fruition on January 20th.
Now, while Joe Biden calls the president's refusal to concede an embarrassment, a number of top Republicans are still backing Mr. Trump. Here's CNN's Jim Acosta from the White House.
President Trump and his GOP allies are steering the 2020 election into something out of the dystopian world of 1984, ignoring last week's results and pretending somehow they won.
There will be a smooth transition to a second Trump administration. Right, we're ready. The world is watching what's taking place.
Secretary of State Mike Pompeo snapped at reporters who asked about the message being sent to the world as the GOP refuses to accept reality.
That's ridiculous. And you know it's ridiculous, and you asked it because it's ridiculous.
President-elect Joe Biden tried to laugh it off.
There is no evidence of any of the assertions made by the President or Secretary of State Pompeo.
Vice President Mike Pence met behind closed doors with GOP senators as the president sent out a message of defiance from his social media bunker, tweeting, "We will win," though Mr. Trump has yet to face reporters since last Thursday.
Thank you very much.
Are you being a sore loser? The president has dug in with the outright support of GOP senators.
Senator, have you congratulated Vice President Biden yet?
No.
Why not?
Who are backing Mr. Trump's legal odyssey in search of some kind of voter fraud case capable of upending the election's outcome, even as the president's campaign has yet to prove anything's amiss.
The president wasn't defeated by huge numbers. In fact, he may not have been defeated at all.
Senate Majority Leader Mitch McConnell says there's nothing wrong with that.
Until the Electoral College votes, anyone who's running for office can exhaust concerns about counting in any court of appropriate jurisdiction. It's not unusual. It should not be alarming.
A key sideshow in the transition turmoil, Georgia's Republican senators have called on their state Secretary of State to resign after Biden's potential victory there. But here's the deal. Those two senators are still fighting for re-election, and alienating the president could upset his base of supporters.
Two Republican members of this chamber have called on their own Secretary of State, a fellow Republican, to resign for no other apparent reason than the fact that President Trump did not win their state.
Despite the GOP's antics, the rest of the world appears to be moving on. Leaders from U.S. allies, Britain, France, Germany, Canada, and Turkey congratulating Biden. Some administration officials are refusing to go along with the president's farce. Attorney General William Barr's call on prosecutors to investigate voter fraud prompted one senior Justice Department official to resign, saying in a statement, "Having familiarized myself with the new policy and its ramifications, I must regretfully resign from my role as director of the Election Crimes Branch." The president's son, Don Jr., and his girlfriend, Kimberly Guilfoyle, have another hostile takeover on their minds. As GOP sources tell CNN, they may have their sights on leadership roles at the Republican National Committee, something Don Jr. denied, but it's a scenario that has some in the party cringing.
Ladies and gentlemen, leaders and fighters for freedom and liberty and the American dream, the best is yet to come.
Private Quietly, Trump advisors are wincing at the idea of pursuing the president's legal challenges to last week's election results. As one advisor told me, quote, "Not sure why the president wants a recount. It's like he wants to lose twice." Jim Acosta, CNN, the White House.
So, while the political fight rages on, so does the pandemic. New data now shows that more Americans are currently hospitalized with COVID-19 than ever before. On Tuesday, nearly 62,000 people with coronavirus were in hospital in the U.S. That's according to the COVID Tracking Project. On average, more than 1,600 people with COVID are admitted to American hospitals each day. Now, despite those numbers, there are concerns that some may avoid getting a vaccine. Dr. Anthony Fauci says he hopes they change their minds.
We have a lot of people in this country who may not want to get vaccinated right away. That's why we were talking that it might take well into the second and third quarter to finally get people to be convinced to get vaccinated. But for those who want to be vaccinated, and I believe the incentive to get vaccinated will be greatly enhanced by the degree of efficacy. When you hear something is 90 to 95% effective, it makes it much more likely that someone would want to get vaccinated.
Now, Dr. Fauci also says he believes a vaccine could be widely available by April, but with case numbers climbing steadily across the country, he said sticking to social distancing measures would be crucial. CNN's Athena Jones has the latest.
Help is coming, and it's coming soon.
Dr. Anthony Fauci hailing the progress Pfizer has made on a coronavirus vaccine, but warning just because a vaccine is on the way, that doesn't mean Americans can relax when it comes to masks and social distancing.
We likely will be able to start dispensing vaccines in December and then progressively over the next few months. But in that interim, we could get into a lot of difficulty if we don't adhere to the public health measures.
Those measures are more important than ever, with coronavirus infections rising in 44 states and new daily cases topping 100,000 every day for the past week.
미국은 이제 마스크를 쓰라고 엄청나게 홍보를 하고 있는데
Among them, Illinois.
우리나라는 13일부터
Any other state in the last week.
벌금형이죠.
Announcing new restrictions in some areas. And experts warn it could get a lot worse.
근데 그렇게 마스크를 안 쓰는 사람이 많아요, 주변에? 나는 밖에 나가서 마스크 안 쓰는 사람 본 적이 한 번도 없는데.
This winter season, when we are right now on track to having maybe 2,000 deaths a day or 200,000 new infections just this winter.
That's 200,000 new infections a day. More cases mean more hospitalizations. 17 states reporting record hospitalizations, including Nebraska, where new restrictions, including new rules on masks, take effect Wednesday, and Idaho.
The numbers continue to be very high. We continue to have 50 plus patients with COVID in the hospital. And just for a reference point, back in September, we were having maybe 10 or even less sometimes patients in the hospital with COVID.
As more people are hospitalized with severe illness, the number of deaths also rises. In El Paso, Texas, hospital morgues have reached the brink. Officials adding 4 mobile morgues to the 6 already in place to handle the overflow. A county judge now likely to extend a 2-week lockdown. And to give you a sense of just how much and how quickly these case numbers are rising nearly everywhere, if you look at the 5 states with the lowest 7-day COVID test positivity rate, so places that were doing well, on Friday, all 5 were under 2% positivity. Today, 4 out of the 5 surpassed that 2% positivity number. It's something that's raising a lot of concerns here in New York City, where the positivity rate stands at 2.8%. If the 7-day rolling average hits 3%, schools will have to go to all remote learning, and the kinds of restrictions we saw here in the spring could return.
In Europe, countries are already rolling out plans to procure and distribute a new Pfizer coronavirus vaccine. That's before it's even approved by regulators. The European Union will authorize a contract today for up to 300 million doses of the Pfizer vaccine. The UK government says it will procure 40 million doses. Some of those may be available by the end of this year, but not all Europeans are convinced.
I think right now it's too premature. Personally, I won't be vaccinated. If I have to die, I'll die my way and not suffer by being tested with a vaccine.
All right, let's get the view now from Europe. Our Salma Abdelaziz is live in London, and Fred Pleitgen is standing by in Berlin. Fred, we'll start with you. When it comes to deploying the vaccine, one could imagine all the various member countries jockeying for position. What's the EU's plan here?
Well, the EU wants to deploy the vaccine, Kim, in a very fair way. It wants to make sure that all the countries of the European Union, also smaller countries, get a hold of the vaccine. That's actually one of the reasons why it was purchased, or why it's being purchased by the European Union and not by the single member states. Otherwise, obviously, it'd be a lot easier for large countries like Germany and France to secure large doses of the vaccine. More difficult for smaller countries, and of course also countries that are not in the same financial situation, like, for instance, big economic powerhouses like Germany, France, and also, for instance, Italy as well. What the Europeans have done, and I've sort of followed that process of the negotiations, is they signed a memorandum of understanding with Pfizer and BioNTech, which is the German part of that cooperation for this vaccine. About a month and a half ago, originally they were talking about 200 million doses that they wanted to purchase. Now they say that today they're going to sign a contract for the purchase of up to 300 million doses once that vaccine is approved. I want to listen in really quick to what Ursula von der Leyen, the head of the European Commission, said about this.
In the past month, the European Commission has been working tirelessly to secure doses of potential vaccines. We authorize a contract for up to 300 million doses of the vaccine developed by BioNTech and Pfizer. This is the most promising vaccine so far. And once this vaccine becomes available, our plan is to deploy it quickly everywhere in Europe.
Now, of course, the processes for all that are a bit different to here in Europe than they are, for instance, where you are in the United States, Kim. Right now, the Pfizer and BioNTech vaccine, which, by the way, is called BNT162, is in a process called rolling approval here in the European Union, which means that as Pfizer and BioNTech get data for that vaccine, which so far has showed efficacy of over 90%, they immediately give that to regulators so they can be part of that process and then give it approval as soon as possible. In the U.S., of course, we know that they're aiming to apply for an emergency use authorization with the FDA. And yesterday, I was actually on a call with the head of the BioNTech lab, Ur Shahin, and he maintains that they might do that as early as next week.
Interesting. All right. Thanks for that. So now let's turn to Salma. You're in the UK there. Vaccine before Christmas, they say, but still many hurdles, I understand.
Absolutely, and of course the UK has to operate independently than the rest of the EU, but just like everywhere else, everybody is hoping, wishing, waiting for this vaccine to be approved. Yesterday, the Health Secretary, Matt Hancock, briefed members of Parliament. He said there is no guarantee, but he has briefed the NHS, the country's National Health Service, to be ready to roll out the vaccine from December 1. Again, no guarantee it would be ready then, but he wanted the health system to be ready for it. They've already began to divvy up who would get it first. That would be those elderly residents in care homes and care home workers, and secondly, healthcare workers. The UK, as you've said, has ordered 40 million doses. And of course, since each person has to get 2 doses, that's about 20 million people who could be vaccinated. But it's important to remember, again, this is not going to be widely available until next year. And the UK right now is struggling to contain a very deadly second wave. Just yesterday, we had in a 24-hour period over 530 deaths reported, over 20,000 cases in that single day. That's the highest numbers since May 12th, when we were at the height of the pandemic. The Prime Minister and the government say that they have a new plan, a new strategy to get a grip on the virus, and that is mass testing. They began a pilot program in the north of the country. That's where most of our coronavirus infection rates are. Just last week to begin to test the entire city of Liverpool. They've already expanded these mass testing sites. We now have over 60 sites, but it's still too early to tell. This is going to help contain the virus. We're also under a nationwide lockdown, so a lot of effort going in to try to bring these infection rates down, but they haven't been able to yet. Kim, just to give you an idea, the UK, if it remains at these levels, could exceed the worst case scenario of 80,000 deaths from coronavirus.
All right. Thank you very much, Salma Abdelaziz in London, and Fred Pleitgen in Berlin. Well, as we reported earlier, a record number of people are now hospitalized in the U.S. due to COVID-19. Earlier, I spoke to Dr. Murtaza Akhtar, an emergency physician, about the crisis. Thanks for doing this. So, As we heard there, hospitalizations have reached an all-time high here in the U.S. You're there on the front lines in the ER. What are you seeing?
Yeah, I hate to use anecdotal evidence. I was hearing what the numbers going up in the country, and I was originally thinking, well, maybe it won't get so bad here, but it is looking rough in the ER. And the problem is, a lot of these patients, sometimes we don't even think they have COVID, but we test them before we admit them, and voila, they have COVID. And so the real concern there is just a couple weeks ago, COVID tests for me were coming back negative if I were testing people. Now I'm getting a lot of people who have the cough, the shortness of breath, the elderly who are coming with even just diarrhea, and a lot of COVID tests are coming back positive, so much so that I'm wondering even if I'm being exposed without knowing it. So it really is, even on the front lines, looking quite a bit worse.
Are there any commonalities there, any threads that you can pull together in terms of how people are being infected? Is it just that people are gathering more indoors these days? Are they not taking it as seriously? Do you have any idea?
Yeah, I wish I knew, because I thought people kind of figured out what was spreading it. I will say a lot of people that I see have family members who are sick. Obviously, if somebody in the household gets sick, it's very easy to spread it to somebody else in the household. But part of me thinks that people have just gotten tired of, quarantining and isolating, etc. And they're just like, well, how long is this possibly going to last? And they're just getting lax, unfortunately, is probably what's happening. And remember, even if there are different states in the country, the virus doesn't know any borders. So if a neighboring state gets bad, it will spread over to the state you're in as well. And I think that's a lot of what we're seeing.
Now, there is good news. A potential vaccine looks much more effective than we thought it might be, but then, to pour cold water on that, it probably won't be widely available, at least according to Dr. Fauci, until the spring. So what are your thoughts on those preliminary results, the timeline, and some of the limitations?
Yeah, I think if you're talking at least about the Pfizer vaccine, that's really exciting. If it really is 90% effective. Now, again, it's a bit early to tell. That's what they're saying. I don't have peer-reviewed studies showing that. But remember, we were being optimistic with even 70-something% effective. So to get to 90, it's almost shocking. And so that would be really awesome if we really do have that level of effectiveness. Obviously, we need more data. But boy, when people have been talking about immunity, this was the way to get to it. Not by getting people sick, but by having a very effective vaccine. And of course, it will take time to get people vaccinated. It's not just a vaccine that saves lives, but actually vaccinating people that saves lives. And so that probably needs to happen as well. But if it really is this effective, boy, that would be a huge game changer.
Now, unfortunately, it won't be here, at least for most of us, for a while. So until then, we'll have to keep using other methods like masks. So now, the CDC is now coming out with new guidance saying wearing a mask, it doesn't just protect others, it protects you as well. So another reason to wear them. We saw Utah issuing a mask mandate. So some states are taking action. But, from a federal standpoint, with the election and its aftermath, dealing with the COVID, pandemic seems to have gone from a low priority to basically no priority at all. So is it going to have to be up to the states to act if we want to get a handle on this?
This goes back to what I said just a little bit earlier. Just because we have different states in the country doesn't mean that the coronavirus cares. It will easily cross state borders because it knows no borders. And so I think if every state does what it wants, you have the issue that we have in this country. When you have a federation of states, the virus goes wild. So I really do think every state needs to have a mandate.
과연 코로나가 끝날까요? 이 백신이 효과가 있어야 될 텐데.
To be determined. I'm not a politician, but I do know this: the virus doesn't care. It will spread. It will find a host, and so everybody really needs to do their part to wear masks when they're in gatherings, and ideally, just not be gatherings at all if possible.
Yeah, well, that's exactly it. Over the holidays, Thanksgiving here in the U.S. coming up, experts are worried about. Given the huge rise in cases, I was struck. The mayor of Sacramento, Darrell Steinberg, came right to the point with a tweet yesterday. So I wanted to read it here. He said, "I cannot say clearly enough. For God's sake, stop gathering. We are doing pretty well with masks and social distancing. It's not enough." Does he have it right?
Yeah, he nailed it. Whether it's for God's sake or for our sake, the ones who are actually susceptible to getting the disease, gatherings are a bad idea. There are some cases where, maybe there's no choice. But by and large, gatherings don't need to happen. If one Thanksgiving out of hundreds of years of them that we've had them, if one Thanksgiving doesn't happen, you will survive. But if you get COVID, you may not. So just this one time, maybe this 1 year, especially if the vaccine really does pan out, just skipping 1 year of holidays, I know it sucks, but it's better than getting sick and it's better than infecting others. I think that mayor nails it, and I wish everybody would do it that way.
Well said. Good advice. Thank you so much, Dr. Murtaza Akhtar. We appreciate it.
Thanks for having me.
Still to come, Hong Kong is trying to disqualify politicians after a new ruling from Beijing. We'll have the latest after the break. Stay with us.
여기까지만 하겠습니다.
Innovate Africa in association with Dangote Transformation.
나 힘들어, 씨, 못하겠어.
So our vision is to support smallholder farming in sub-Saharan Africa. There is a farmer based in southwest Nigeria. He was losing 60% of his produce due to